Hey everybody, my name is Cyrus Dave Dacumos, a level 3 nursing student, and today I will be obtaining electrocardiogram. First is verify the order. Step 2, confirms the client's identification, compares the name with the name on the client's ID bracelet. Step 3, provide privacy and explain the procedure to the client. Good morning, sir. My name is Cyrus Dacumos and I will be your nurse for today and I will be obtaining your electrocardiogram. Number 4, wash hands, don gloves, a face shield, and a gown if needed and follow standard precautions. To set up the machine to record a 12-lead ECG, explain the procedure to the client. Tell the patient that the test records the patient's electrical activity and it may be repeated at a certain intervals. Emphasize that no electrical current will enter to her body. Tell the patient that the test typically takes about 5 minutes and ask the patient about allergies to adhesive as appropriate. Remember that explanation relieves anxiety and facilitates cooperation. Possible allergies may exist related to adhesive on ECG leads. Morning, sir. Today we will be doing electrocardiogram and this procedure will take about 5 minutes. And sir, may I ask if you have any allergies to adhesive? No? Okay, thank you. Number 6 is place the ECG machine close to the patient's bed and plug the power cord into the wall outlet. Remember that having equipment available saves time and facilitates accomplishment of tasks. Number 7, if the bed is adjustable, raise it to the comfortable working height, usually elbow height of the caregiver. Remember that having the bed at the proper height prevents back and muscle strain. Number 8, have the patient lie in a semi-fowler position in the center of the bed with the arms at the sides and raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately and encourage the patient to relax the arms and legs. Remember that proper positioning helps increase the patient's comfort and will produce a better tracing, and having the arms and legs relaxed minimizes muscle trembling and which can cause electrical interferences. Lagay lang po natin yung kamay niyo po sa gilid. Ayan. And then adjust po natin yung ulo niyo po. Ayan. Number 9, select flat, flashy areas on which to place the electrodes and avoid muscular and bony areas. Number 10, if an area is excessively hairy, clip the hair and do not shave the hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Remember that shaving causes microabrasions on the chest skin. Oils and excess hair interfere with electrodes contact and function. Alcohol, benzoin, and antiperspirant are not recommended to prepare the skin. 11 is applied lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. White is for the right arm. Green is for the right leg. Red is for the left leg. And black is for the left arm. Peel the contact paper of the self-sticking disposable electrode and apply it directly to the prepared site as recommended by the manufacturer. Position disposable electrodes on the legs with the lead connection positioning superiorly. Remember that having the lead connection positioning that is positioned pointing superiorly guarantees the best connection to the lead wire. Number 12, connect the lead wires to the electrodes and make sure that the metal parts of the electrodes are clean and bright. Remember that dirty or corroded electrodes prevent a good electrical connections. Number 13 is expose the patient's chest. Apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. Or V1 to V6 leads are applied to the chest. And peel the contact paper off and self-sticking disposable electrode and apply it directly to the prepared site as recommended by the manufacturer. One is for the fourth intercostal space at the right sternal border. V2 is for the fourth intercostal space at the left sternal border. V3 is the halfway between V2 and V4. V4 is for the fifth intercostal space at the left mid-clavicle line. V5 is for the fifth intercostal space at the interior-exterior line or halfway between V4 and V6. And lastly, V6 is for the fifth intercostal space at the mid-axillary line, level with V4, proper lead. Yan. Remember that proper lead placement is necessary for the accurate test results. 14. Connect the precordial lead wires to the electrodes and make sure that the metal parts of the electrodes are clean and bright. Remember that dirty or corroded electrodes prevent good electrical connection. Number 15 is after the application of all the leads, make sure that the paper speed selector is set to a standard of 25 minutes per second and that the machine is set to a full voltage. Remember that the machine will record a normal standardization marked square, that is the height of 2 large squares or 10 small squares on the recording paper. Number 16, ask the patient to relax and breathe normally, and don't forget to instruct the patient to lie still and not talk while you record his ECG. And remember that lying still and not talking produces a better tracing. And sir, please remain from talking and stay still lang po para po mai-record ko po ang inyong ECG. Then press the auto button and observe the tracing quality. The machine will record all 12 leads automatically. Machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skin if necessary with adhesive remover for sticky residue. Remember that removal and cleaning is to promote patient comfort. Number 19 is after disconnecting the lead wires from the electrodes, dispose of the electrodes and return the patient to a comfortable position and lower the bed height and adjust the head to a comfortable position. Remember that proper disposal deters the spread of microorganisms and positioning with the head adjustment is to promote the patient's comfort. Lowering the bed height promotes the patient's safety. Sir, ibabalik ko lang po kayo sa comfortable position niyo po. And then, didispose ko na po itong mga ginamit ko po natin kanina. Number 20 is observe and practice body mechanics all throughout the procedure. And lastly, 21, shows calmness while performing the procedure. Thank you for watching for my return demonstration. Bye-bye!